Hello everyone, my name is Hannah Walsingham, and today I will be discussing the genetic makeup of neurological disorders. Our learning objective today is to differentiate between the genetic and environmental causes of neurologic disorders. So, as we've previously discussed in other lectures, a neurologic disorder is a disease of the central and peripheral nervous system. And some examples of these disorders include strokes, migraine disorders, Alzheimer's disease, Parkinson's disease, and multiple sclerosis. There's many other disorders that I have not listed, but mainly today we'll be focusing on strokes, Alzheimer's disease, and multiple sclerosis. So the question here is there a genetic compound or a component to these disorders, or is it mostly just influenced and caused by the environment that the person is living in? So first we'll be discussing depression and strokes. Now, depression is a major risk factor for strokes. In 2018, a study was conducted showing the analysis of a polygenic risk score for depression leading to ischemic strokes. The polygenic risk score is the total number of genetic variants that an individual has to assess their heritable risk of developing a particular disease. So when they did this analysis, they looked over 12,000 stroke cases and 25,000 control cases, all of European ancestry. And for every change in the polygenic risk score for major depressive disorder, the risk of an ischemic stroke increased by 2.6%. So the results are showing that a higher polygenic risk score for major depressive disorder is associated with an increased risk of ischemic stroke. Now, the underlying cause connecting the genetic predisposition to stroke risk is still unclear. Now, they also did another study analyzing African American ancestry cases, and they compared their findings to the European study, and they actually revealed a 7% increased chance in ischemic stroke. All right, so as we've discussed, epigenetics is the study of how behaviors and environment affect the way your genes work. Pharmacotherapy is the treatment of a disorder or a disease with medication. Some genetic factors that affect pharmacotherapy. One is the human leukocyte antigen. This is an allele that has a rather potent pathology, and it's mostly associated with multiple sclerosis. However, it's also seen in Alzheimer's disease. So some studies that have been performed show that an increased frequency of one type of the human leukocyte antigen has provided patients with a better outcome on the IFN beta treatment. However, antibodies begin to form and they go against the IFN beta treatment and decrease the efficacy of this treatment. So this poses an issue for pharmacology and leads to new medicine needing to be created. So this is some epigenetic factors that affect pharmacotherapy. One of these is folate, which is a compound that helps with the conversion of SAM, and that assists with DNA methylation. There was a study done in 2021. It followed 579 elderly volunteers over 9 years and recorded their vitamin intake. So the results showed that only 57 of the participants developed Alzheimer's disease, and the study was actually able to show that having folate taken at or above the regulated limit showed a reduction in the risk of Alzheimer's disease. And just to conclude everything, so in some disorders we can see strokes and multiple sclerosis. We can see a larger genetic effect on these disorders, whereas we see in Alzheimer's disease that human behavior and the environment have a larger effect on these disorders. So we can see folate can reduce the risk of Alzheimer's disease, or sometimes with strokes, if you're just genetically predisposed to depression, that can lead to having that. So although we can point out certain alleles that cause these specific disorders, there are many unknowns still left to be discovered and many genetic components that have not been uncovered yet. So thank you all for listening. And here is my references listed. Thank you.